Ensure that you've got the right medical gas by checking the cylinder label, which is on the side of the cylinder and also on the collar. Check the expiry date on the batch label. Make sure that the contents gauge is in the green zone. This is a new cylinder. If the cylinder has been used before, make sure you've got sufficient gas for treatment by inspecting the contents gauge. Remove the tamper cover on the hand wheel by pulling the tear ring. Open the valve outlet cover to expose the Schrader valve. Place the cylinder into a safe cradle when using on the patient, but set this away from the patient at first with the demand valve. Connecting a demand valve to the Schrader outlet. Ensure that the demand valve is clean and ready for use. Make sure that it's in service state. For each patient, you need to use a new filter mouthpiece. You're connecting the mouthpiece to the filter, aligning up the clip to each of the sides of the demand valve and listen for that click. You're attaching your probe to your outlet. And then you're opening the hand wheel slowly, and that's just to open the valve. Don't over tighten it, just wait for it to come to a steady stop. Check the demand valve is operating by pushing the test button. Ensure you can hear the gas flowing. Check for leaks, which may be indicated by a hissing sound. Monitoring during use. Instruct the patient on how to use the demand valve correctly before commencing the therapy. Using scavenging equipment wherever possible to avoid a buildup of nitrous oxide in the environment. Ensure that the clinical condition of the patient remains satisfactory throughout the therapy. Check the contents gauge at regular intervals to make sure that there is enough gas to continue the therapy. After use, take the demand valve away from the patient. Turn off the cylinder by closing the hand wheel. Vent any residual gas in the hose by pressing the test button. Wait for the gas to stop venting. Disconnect the probe from the Schrader valve. Replace the outlet cover and check the gauge to make sure that there is content for the next patient. With all equipment, make sure that you clean the equipment appropriately, and that includes removing the demand valve, the mouthpiece, and getting ready for the next patient.